So that's easy to say, and when you see an example of when it's being done well, great, it's easy to see, but how do you actually try to do this? How do we get to a place where we go back tomorrow and we start to bridge that emotional gap and understand patient emotions in a better way? I think we're in a place where we can do this differently, and we're better served than we have been in the past. So I'll talk about a couple of things we can think about as we move into this. The first is we've got the opportunity to innovate to get richer data. So 2 or 3 things to just touch on. The first is the change in the environment that social media is facilitating. Andrew talked about this extensively in his presentation. But if we look beyond just patient power and individual advocates, these patient opinion leaders who I think are very important, just a discussion fora on sites, whether they're advocacy group-led sites or just general sites on the internet, and I've put a couple up there. Health Unlocked is one in the UK that I think is particularly prevalent. Patients Like Me, of course, is very important internationally. There's more information out there on how patients feel about their condition, about their disease, about their treatment than we've ever had access to before. And the opportunity to engage in understanding that and interacting appropriately in those settings can really help us understand how patients feel. The second thing is that Michel Deray, I think, is going to talk extensively about research techniques to get richer data. But integrating technology into traditional patient-level research can really give us more emotional immediacy. We're doing some work at the moment where we're integrating mobile devices into patient research to allow people to give us insights, give us perspective in real time. And I've seen a few of these, and the emotional resonance of them is much, much stronger. The second is co-create. And this is back to Sinead's point. If we think about where the journey was originally, traditionally what we've done is do research, get in a room of our own company people, build the journey, and if you're lucky, we'd then go out and validate with some outside with patients, with physicians. There's an opportunity to look at co-creation here where we actually bring patients, healthcare professionals, and ourselves together to look at that data and co-create the journey. It sounds really obvious, but actually I think this is one of these examples where in my company, for instance, things are a bit sporadic. Our vaccines team is doing this really well, and they've got a really nice model for it. But we've not done it that well in oncology, where I've been. We're just starting on that journey, and we're doing some things better than others now. So there's a real opportunity to do that well. And the last thing is actually involving our own company personnel emotionally in creating the journey, making sure that they are engaged through and ensuring that there are workshops that they can be involved in, ensuring that they get exposure to patients and patients' perspectives, and ensuring that we're not just handing something over if you're in the creation team. One thing I would reflect on is that for a lot of the conditions that we try to develop medicines for, in our organisations, particularly if you're in a large organisation like mine, there are lots of people who work for the company who suffer from the condition. I work in oncology, and in the last couple of years I've worked with patients with chronic myeloid leukemia, people who've had living with breast cancer, and people who've had fairly advanced melanoma at the same time as I've been working on drugs for these conditions. And yet I've not seen my organisation actually try to understand how those individuals feel about their condition. We've not really used people within our organisation to better understand their perspective on disease. And when you think about it, that seems crazy. If we do those things, I think we move from a state where we've got that wiring diagram to something that still gives us a feel for where the patients go, but which can overlay that sense of how they feel along the way. And it's a different picture. It's that more human picture, I think, that Andrew was talking about a little earlier in his talk.